Hey everybody, Dr. Jared here. Wanted to talk to you specifically today about the topic of arthritis. And when I say arthritis, I mean osteoarthritis. This is something that a lot of people ask about. They think it's genetic. They think they're just going to have it. They think it's just going to get worse with age. And while there are certainly some genetic predispositions, something that's not as well understood about arthritis is how to prevent it, or if you have it, how to maintain it. And so, what arthritis, if we're going to break it down to its simplest form, osteoarthritis is created from bad motion in a joint. So whether that's mobility restriction, twisting, rotation, whatever it might be, when the joint loses mobility, what happens is it starts to have significantly increased wear and tear. So that can cause bone spurring, it can cause deterioration in the disc or meniscus, and overall often causes inflammation, which for a lot of people leads to increased pain, or maybe they can tell when the weather's changing, or they're not able to exercise as intensely, or even stand on their feet for long periods of time. But if I could give you an example of why arthritis can be maintained or possibly prevented with routine chiropractic treatment, I'll use the example of hitting a pothole. So, like joke, unfortunately, there's a lot of potholes on the streets of Rockford. I've blown at least one tire every single year. Maybe you guys have better luck than me, but just kind of the reality over the last 6 or 7 years. But when you hit a pothole, if you jam your tire significantly and it shifts or it rotates, everybody knows a tire out of alignment wears out more quickly. And so many people, when they can tell their tires are imbalanced, they go get tire realignment. They go to the mechanic and they get it realigned. Additionally, maybe a better analogy is the wheel bearing in that same tire can often rust more quickly because it's grinding or it's not moving as efficiently. And when you rebalance or realign the misalignment, of course, it stops or prevents that. Similarly, with your joints, especially the joints in your spine or some of your extremities, if it gets shifted out of place, when you're 20 years old and then you work your profession for 40 years, or, if you just consistently have lost flexibility or have lost range of motion from maybe too much sitting, or having to sit at a desk job, or having a very physical construction job, or whatever it might be, once it's out of alignment, it's going to start to wear out. Now, this wear is often not noticed in the early stages. In fact, there's some research studies that show that it can take average of 20 years before you start to feel arthritis pain or discomfort from the wear and tear of the arthritis itself. One of the statistics on arthritis is that it gets 7% worse per year on average. So mild arthritis might take a long time to be felt, but we all probably know somebody who over the course of 2, 5, or 10 years in their 50s or 60s or 70s, all of a sudden they can barely move. And that's just like compound interest with money. That 7% gets a lot more dramatic the worse the problem is. And so this is why I'm such a big advocate with arthritis at making sure you have a plan or a schedule of a combination of chiropractic adjustments as well as home therapies or rehabs to really try and protect it. And so that's one of the things we specialize in at Chiropractic First, is helping to maintain or prevent. I will tell you now that I've been in practice here for well over a decade. I've now seen people who started 10, 11, 12 years ago, and they had significant arthritis and they've been getting adjusted very routinely, and they've been doing other things to take care of their health, and they've had zero progression of the arthritis on their x-rays. In fact, one of the things I did before I opened our clinic here in Rockford is that I worked at a clinic up in Winnipeg that had actually been open for 50 years. It was opened by a father and a brother, or of my mentor, his uncle and his father, and was transitioned to him and his sister. And they had clients there that I personally met, dozens of them, that had been coming on a regular basis. And I met them. I looked at their most recent x-rays. I looked at their old x-rays that might have been 40 years older. And those that had routinely been treated, for the most part, had minimal or no progression in arthritis in the joints that had been significantly damaged. So it is possible to stop arthritis. It is possible to prevent by getting adjusted regularly, even if you don't have arthritis, for maybe yourself or your children or your grandchildren. But also, this really goes back to investing in your health. Nobody ever wants to be limited in motion, to be stopped doing what they enjoy, to be in pain, or to really not to participate in things they want to. But sometimes ignorance, negligence, avoidance can cause the same issues that nobody ever intends. So keep in mind, you'll never, ever, ever regret investing in your health. Hope you have a very blessed day.